Leg pain and leg cramps are very common in pregnancy. What causes leg pain? What are the symptoms other than the leg pain, leg cramps? What are the aggravating factors? What to do as a measure of immediate home relief? Home remedies for leg cramps and leg pain in pregnancy. What is the treatment of leg pains? Can one do something to prevent leg pains? What are the exercise to do for leg pains in pregnancy? We'll discuss all those things in today's video. Good morning, I am Dr. Rajat and you have started watching our YouTube channel, The Fertility Gynecologist. So, why are leg pain common in pregnancy? Pregnancy, as you all know, is a progesterone mediated condition. Progesterone hormone is high in pregnancy, and because of progesterone hormone, the leg cramps are common. Secondly, in the later half of the pregnancy, 5th, 6th, 7th month onwards, the pressure of pregnant uterus or a gravid uterus on the bigger vessels of the abdomen like inferior vena cava, what it does is, because of the pressure, there is an increased pulling of blood in the legs, and as a result the edema occurs. Because of that edema, the stretching of the nerves occurs and leg cramps and leg pains occur. Also, most of the females, especially when pregnant, they are drinking less water. They are usually dehydrated because of vomiting in first 3 months of pregnancy, because of acidity in later half of pregnancy. So they are dehydrated, and as a result there are increased chances of leg cramps. Also, the pressure of pregnant uterus leads to increased chances of varicosities, varicose veins in the legs. So these are the causes of leg pain in pregnancy. So apart from the leg pain and the leg cramp, there is usually nothing much symptomatic. What happens is, sometimes the leg pains occur in the sleeping time or sitting time, or sometimes if the female walks. So what are the home remedies of leg pain? Everybody knows, whenever there is some kind of pain, if you do some kind of a massage or malish, or if you rub that area, you will feel relief from that pain. That is a first year physiology topic. The pain and the touch sensory tract are spino and lateral and anterior spinothalamic tract. The moment you rub, you will perceive the decreased sensation of pain. Application of ice immediately, if the pain is there, ice application does wonders. It produces a local anesthetic effect. That means the pain sensation is decreased, and also the analgesic effect. If the pain persists for few days more, then you can use hot water along with salts, a rock salt preferably 100 to 200 grams, and dip your legs till the knees. And after you dip your leg till the knees, after half an hour, you apply any kind of moisturizer, emollient, or any kind of coconut oil and give a good massage to the legs, including the feet. That will relieve leg pain or leg cramps in most of the cases. Also, if there is pain while walking, the moment the moment you're walking and there is a sudden pain, the important thing is not to continue walking. You stand or sit at one place, do some kind of massage, do some kind of active and passive stretches, and in most of the cases there will be relief. Also, for the prevention of chronic leg pains or leg cramps, you should do some kind of exercises. These are standing lunges. What you should do, if you are sitting, standing, or sitting, first of all you take your toe of the foot up, hold it for 5 to 10 seconds. Then you stand on your toes, lift the heel up. You can do it while sitting, you can do it while standing, you can also do it while sleeping. And also these have to be both active and passive. Passive means you are using the force of your hand to do this. Either it is dorsiflexion or it is plantarflexion, and it can be active. You use your muscles. You can also use therabands or to increase the power and strength in those things. How do you stretch for leg cramps? Again, I have told you dehydration definitely causes leg cramps. I have told you hormone, mainly progesterone, is responsible for the leg cramps. Now, the episodes of leg cramps, they last for about few minutes to about 10 minutes maximum. If I go to first year physiology, calcium and magnesium, they play an important role apart from sodium and potassium in the muscle contraction. So any kind of dehydration which lead, any kind of dehydration which may be because of vomiting, which may be because of diarrhea, or which may be because of excessive perspiration, may lead to loss of electrolytes, and that may lead to increased cramp. Even those females who are deficient in calcium, and most of us nowadays are deficient in magnesium, they can lead to the increase in episodes of muscle cramp. Also, one of the other causes of leg pain in pregnancy is the sciatic nerve. Now, the episodes or the incidence of sciatica increases in pregnancy. Sciatic nerve is a big nerve which is supplied to the whole leg. It arises from the spinal cord, and from the back it goes through the pelvis, it goes to the leg. So the pain is typically, the patient would complain from the hip to the back side of the leg till the toe there is pain. This sciatic nerve is very thick, is approximately half to 1 centimeter thick. It is said that you can literally lift the leg of a person through with the sciatic nerve. It is so thick. Now this nerve, when it travels through the bones and travels through the muscles, gets compressed at various places. In pregnancy, because of edema, because of subcutaneous edema, because of swelling in the muscles might, the nerve, sciatic nerve might get irritated, might get compressed at various places, and as a result, the pain in the leg occurs. The most important factor for relieving the sciatic nerve pain is doing the hip opener exercise. Later half of the pregnancy, the hip opener exercises cannot be done. But if you are in the first half of the pregnancy, you can practice butterfly. Butterfly is a good hip opener exercise, and routine doing of butterfly also helps later on in the process of normal delivery. So this will relieve the sciatic nerve in the pain of sciatic nerve in pregnancy. ORS is another important thing, oral rehydrating solution, which is very important for the replenishment of electrolytes in the body, which may have occurred because of excessive perspiration, excessive dehydration due to diarrhea or vomiting. So ORS may help in the cramps of pregnancy. ORS is very simple to prepare. Take a packet, boil 1 liter of drinking water, cool it, mix the packet and drink it. You can have 1 or 2 sachets per day in place of drinking water. Take it for a couple of days till the episode of vomiting diarrhea subsides. The moment the vomiting diarrhea subsides, you can stop taking ORS. ORS should not be taken routinely. So this is very important. So, do leg cramps harm baby in any which way? Answer is no. Are leg cramps harmful to mother? Answer is no. Can leg pain in pregnancy be harmful? See, there are only 2 cases of leg pain which can be harmful to the mother. One is a peripheral vascular disease and one is varicose veins. Peripheral vascular disease is called as, the pain of peripheral vascular disease is called as claudication pain. Patient walks for 50 meter or 100 meter and there is severe pain in calf, and that distance of walking decreases over a period of time. That is because of the vasoconstriction or the blockage of the posterior tibial or the dorsalis pedis artery. Excuse me. And the varicose veins, like I mentioned earlier, because of the pressure of the gravid uterus, the veins of the lower limb become imperforate, and as a result there is a pooling of blood in the limbs and the veins become prominent. These two entities can be diagnosed by a Doppler ultrasound of the lower limbs, and if there is a positive report on peripheral vascular disease or a varicose veins, immediately surgeon opinion has to be taken, and some kind of drugs in form of Trental or low-dose aspirin or some kind of exercises have to be started, or some kind of a above knee or a below knee bandage for varicose veins have to be done. Definite surgical management for peripheral vascular disease or varicose veins is not advisable in pregnancy. It has to be postponed till the delivery is done. So, do leg cramps harm the baby? Answer is no. How long does a leg cramp last? The cramp usually lasts from few minutes to 10 minutes. There is also one of the important pain in leg, that is a inner side thigh pain. Now you have to remember that there are two sides of hip bones which form the pelvis, and the anterior part of the pelvis is called as symphysis pubis. They are joined by the two hip bones from the pubic symphysis. This joint becomes loose in the pregnancy, and that is under the influence of a hormone called as relaxin, which causes most of the joints in the body to become loose, especially the pelvic joints. And the purpose of these joints become loose or relax in pregnancy is so that they become relaxed by few millimeters, so that the head of the baby can pass through the pelvis in during the process of delivery. And because of that looseness of the joint, they causes the pain on the inner side of the thigh, and this is called as SPD, symphysis pubic dysfunction. But no active treatment is given for those kind of females. You just do local heat pad application or localized application or local analgesic application. It usually subsides within few days. You don't have to do anything active for that kind of thing. Now, do you require any treatment for leg pain in pregnancy? Since there is no definite indication, no definite cause of leg pain in pregnancy, so there is no definite treatment. Some people can give multivitamins, some people can get relief from vitamin E. Magnesium deficiency definitely does cause the leg cramps and leg pain in pregnancy, and most of the doctors give magnesium either in combination with calcium or in combination with other things. But magnesium supplementation is good. Even magnesium rich diet is good. Magnesium is found in most of the nuts, most of the dry fruits. So about 50 to 100 grams of dry fruits per day, 50 to 100 grams of nuts, sesame seeds, chia seeds, pumpkin seeds. These are rich sources of magnesium. And magnesium sulfate along with, or a magnesium supplement along with calcium should be given in approximately 2:1 ratio. So they cause better this thing. So how do you reduce your pregnancy cramps? Drink plenty of liquid. This is one and the most important thing. The liquid can be in form of plain water, it can be form of coconut water, it can be in form of lime water with less salt and sugar, it can be in form of soups with less white salt preferably, it can be in form of juices, preferably vegetable juice, not fruit juice, it can be in form of liquid dals, it can be in these are the liquids. It can be in form of nimbu pani with less sugar. If your partner is smoking, again smoking contains nicotine. If partner is smoking, you'll inhale it. There will be a passive smoking. So try and be at a relative distance from the partner if the partner is smoking, or try and wear mask, because nicotine can cause peripheral vascular disease, especially if you are susceptible. Elevate the limbs while you are sleeping. Now, what is the posture in which one should sleep to prevent the leg cramps or leg pain in pregnancy? Ideally, you should not be sleeping on the back side. You should be sleeping on one side, preferably left side. You should be folding your knees and folding your hips, and put a round pillow between the two legs with the legs elevated. And you should be basically sleeping in the fetal position. You should be wearing loose clothes. Even the bed sheet should be loose, so that the movement of the feet is not hindered. This is the position. You should not be sitting continuously for long hours. You should not be standing continuously for long hours. Take a frequent break between the positions. Don't be seated for long. Do frequent changes, do frequent exercises, do all kinds of hip and leg movement, and drink plenty of fluids. Tea, coffee should be avoided, as in excess quantity should be avoided, because they cause dehydration. And avoid processed foods. What should one eat? What should one avoid in patients of leg cramps in pregnancy? Eat. Should take plenty of green leafy vegetables. The green leafy vegetables contain multivitamin complex. It contains folic acid, it contains vitamin B6, it contains other vitamin B complex group of vitamins. Take all fresh fruits, preferably in moderation. Take plenty of salads, especially carrot, which contains vitamin A, especially beetroot, especially spinach, which contains iron, especially cucumber, which also contains fiber, along with the hydration aspect would be taken care of. Tomatoes again contain antioxidants like lycopene, so they will help in overall decreasing the inflammation of body. Avoid processed food and packaged foods. Any kind of chips, vapors, biscuits, anything made from maida should be avoided. And avoid sedentary lifestyle. Always be mobile. Always be mobile. Avoid sugar in excess quantities. You can use a heat pad application, you can use an ice pack application, do good rubs, good massage. You can do it on your own, you can take the help of somebody to prevent it. Now, question arises whether heat pad should be used or ice pack should be used. If there is an acute episode for first 24 to 48 hours, ice pack is a good thing. Ice, what it does is first 24 to 48 hours, in any kind of a injury or any kind of pain, there is an inflammation means increased blood flow to that area. More prostaglandins are secreted, and ice pack is a good way to decrease inflammation to give a symptomatic relief. But if the leg pain becomes chronic, then heat is a better thing. You can use hot water bags, you can use hot pads, or you can use hot water dips. You can dip your legs till the knee in the hot water along with Epsom salt or rock salt. Epsom salt is better because the magnesium would be absorbed in the body, and magnesium, the main role is it is absorbed through skin rather than taking the oral supplements. Oral supplements can also be taken in combination with other multivitamin and minerals, but magnesium is better absorbed through skin. Banana is a very good fruit for leg cramps. It not only contains calcium and magnesium, but it also contains vitamin B6. It will also prevent the constipation, so it is a superfood as far as the leg cramps in pregnancy is concerned. Now, does walking help, or it will worsen the leg cramp? If it is a peripheral vascular disease, walking may not help, but in other kinds of leg cramps of pregnancy, the walking may help. While walking may not directly help with the leg cramps, but it will overall keep the mobility and the contraction and relaxation muscle of the part of the muscle going, so it will overall help with the leg cramps. Standing lunge is the best exercise for leg cramps. You can stand and then do like this, or you can stand and then hold your legs like this. So this has to be done, and when you are doing a lunge, I'll put the link of the video in the description. When you are doing the lunge, the hold for 5, 10, 20 seconds is very important, because that the hold part of the exercise is what will prevent the leg cramps. So how do you sleep? Again, I have told. How to prevent the leg cramps, I have told. So as a doctor, if some patient comes to us with a complaint of leg cramps, first of all, we do not give any medicine initially. What we tell: improve your lifestyle, take plenty of fluids, plenty of fiber, avoid processed food, and be mobile, and do some kind of active and dynamic stretches. Even after doing that, if they still do not get relief, then we ask them to do some kind of a massage or a malish or rub with any local emollient, moisturizer, Vaseline, coconut oil, whatever, and dip the legs in hot water with Epsom salt or rock salt. Still do not get relief, then we give some kind of a magnesium, vitamin B complex, and vitamin E, which in most cases helps, but we keep it for the last. Still, some patients, they still complain of pain in legs, but then these pains will be there till delivery, and most of the leg cramps they get relief after few days after delivery. So still, even after doing everything like hot water dip, massage, local application of hot pads or ice packs or exercises, patient does not get relief, then we do not do anything and we just tell them that you have to bear it, and after delivery you will be cured. So this was our small session on leg cramps and leg pain in pregnancy. Hope you liked the video. For any questions, further questions, you can give in comments or DM us. Please like the video, share the video and subscribe to our channel. Namaskar. Bye bye.